let's talk about the issue of funding and resources. Not only Ireland, but I think all national healthcare systems are under pressure to make savings and to operate as efficiently as possible. What should be the priorities in allocating resources to improve osteoporosis treatment and diagnosis?
So there's a bit of a myth out there in certain circles that extra money is needed and extra resources are needed. But in actual fact, the biggest problem with the Irish healthcare system is waste. There's bog loads of resources and they're being used ineffectively, inefficiently for the wrong people in the wrong place at the wrong time. Reallocation of some of those resources to make sure all the patients who are admitted with fragility fractures have the right diagnosis, have a fall prevention assessment, and the right medication. So what that's going to require fundamentally in all the big trauma units where the fracture patients are admitted is a clinical nurse specialist, a physician, a pharmacist, and a physiotherapist and an occupational therapist who are dedicated to providing an appropriate comprehensive inpatient assessment and the appropriate community services for the patients in their own home, where they can see and assess the patients and manage the patients at home and prevent the next hospital admission. All the international evidence is very clear. If you put the resources in place, it doesn't cost more money, it saves more money. So in 2020, the estimate for Ireland was we're spending about 1 billion in caring for these fracture patients, and by 2030 that number will be 2 billion, which is an enormous amount of money. And the recent EU report suggests that Ireland would have the greatest increase in cost and the greatest increase in fractures in people over 50 in the next decade. And the only way to reduce that is to target these people with the right diagnosis, with the right interventions, not inappropriate interventions. We'll actually save money. A great example is we're seeing a huge problem in Ireland at the moment where young healthy people who shouldn't be getting a DEXA are being sent for a DEXA and getting a DEXA. It's a waste of money, they don't need it. The second thing that happens is they're all taking calcium and vitamin D. All the evidence is in these young healthy people, if they take extra calcium and vitamin D, they more than double the risk of fracture. Nobody believed that 10 years ago, but now the biology has been worked out as to how that happens. So we know by diagnosing people with a disease they don't have, it does result in overtreatment. We also see people on drugs for osteoporosis that should never have been started. And some of those end up with fractures related to toxicity from the drugs because they're taking them for a long time. So they end up in overdiagnosed with the disease they don't have and treated for something they don't have. And they finally end up with the disease they're trying to prevent. If we stopped all that nonsense and moved all that money and all those resources to managing the people who are 65 and older, that's not an additional resource. It's actually using the resources for the right people. We'd save a fortune. We'd probably reduce the risk and the cost of fractures in these patients and reduce mortality by up to 50%. That's what all the international evidence shows. The number of people who die following a hip and a spine fracture, if we assume spine fracture mortality in Ireland is the same as America, is greater than the number of people who've died from COVID every year in Ireland in the last 3 years. We've seen what's happened with COVID. They threw loads of resources at it. And now we know the number of people with COVID diagnosed every day, the number who admitted to the hospital, the number who died in the hospital, and the number who died following hospitalization. Those simple statistics should be available for osteoporosis, just like every other disease. Osteoporosis is a bigger problem, but as Michael Collins said, it's hiding in plain sight today.